Hi guys, and welcome to yet another video. Today I'm going to work. I had 2 days off and I'll be working 4 days in a row. I'm assuming, or I hope that I'll be going to my 9th floor. 2 days ago when I worked, I was floated to the medical surgical unit, and usually when I'm being floated there, I get to have 5 patients maximum. It was an okay shift. One of my patients ended up pulling out their NG tube, and hopefully tonight I'm going to my step down unit. So guys, I am so excited and happy to make another video to show you guys what happens on the step down ICU unit. So guys, follow me. Let's go to the 9th floor of the neuro intermediate care unit of my hospital. Let's go. The drive to my hospital is not a very long one, but I love taking my time driving to the hospital. Like I always say in all my videos, I love getting to work very early because it gives me ample time to check up on my patients, to give me a bright head start to what my shift is going to look like. I look up my medications, I look at what I have to do, any labs to collect, any procedures that I have to take my patients downstairs for, and also giving me a heads up as to what to ask the nurse during bedside shift report. All labs and everything, I have them ready to go. So after getting my report, as usual, I always love reading my notes. Reading your notes of your patient is going to give you a holistic head start as to what each patient is looking like, what have been done on the patient, how the patient have came to the hospital, how they have progressed so far, what the future plan is, and basically what medications they're getting, how their vital signs look like with the medications they're getting, how their labs look like. It just gives you a summary of everything that has been done for your patient. Now it's obviously time for me to go pull out my medications. I usually don't like showing this part because I'm always scared of revealing something which I'm not supposed to reveal. But anyways, back to pulling out medications for my patient. So Zosyn is one of those very common IV medications that we give to patients in the hospital, patients who are at risk or who have infections, because it is kind of sort of like a general antibiotics that will tackle gram-positive and gram-negative bacteria. So one of my patients had their IV Zosyn, and here I was after medications were done. I had to come back now and start chatting my assessment and looking up at what other things I might have missed, if there was any urine sample to collect, sputum, poop, or looking forward to maybe my patients being NPO at midnight for any procedures the next day. But basically, after my medications have been passed, my 9 o'clock medications, which can typically always be given beginning from 8 p.m., I come now and I start documenting. I know most of you are going to say, when do I do my assessment? Like I always say, I always do my assessment when I'm giving my medications for my patients. Now, on this shift, I had 2 patients and I was expecting 2 patients. So here I was receiving a report for one of the patients who is coming from another facility. And guess what? At the same time I was receiving this report, my second patient report was on the phone waiting for me from another, from the ED. So after I got the reports from this patient from another facility, I quickly looked up at what to expect, if there was anything the nurse forgot to tell me, just so that I have a heads up as to what to ask when the paramedics arrive at the hospital with the patient. So after the brief look at what the patient is looking like, especially the vital signs, IVs, if the patients have Foley's, what medications the patients have had, or if the patients are still pending their night medications, and what the medications will be expected to give them as the shift progresses. So I always love to look at what the patient coming from the other facility especially will be looking like when they hit the floor and I have to start my care on the patient. While I was done reading the report, it was now time for me to pick up the next report that was waiting for me. So this was a report for one of my patients coming from the ED. And when patients come from the ED, I always have my questions preset to ask the nurses, because if you don't ask, they will barely tell you any information. And by the time the patients hit the floor, you are going to be finding that the patients have a Foley. You don't even know why they have a Foley. Maybe they have a drip and you're asking yourself why. So this was me getting the second report for my patient. Okay guys, so it is after midnight, 30 minutes after midnight, and I'm only getting a chance to update you guys now. So when I got on to the unit, I was scheduled to have 4 patients as usual, but I had one open room and one patient was leaving for the heart hospital for an ablation, which is a procedure, because patient was in A flutter and the patient was also running a cardism drip. So I just basically got like a summary of reports for the patient, and in 15 minutes they came to pick up the patient to move to the heart hospital. So pretty much began my shift with basically 2 patients. So had to go through reading my reports or reading notes for my patients. Basically I already sound like a broken record at this point, trying to know what has happened to all the patients and what they anticipate to do. And then when it was time for me to give medications at about 8 p.m., one of my patients wanted to leave AMA. Pretty much they said they were tired of being in the hospital. They had been in the hospital for a week and they were missing family and wanted to leave. So I had to call the provider to come talk to the patient, and it was just a back and forth, patient calling family, and patient finally changed their mind and decided to stay the night. So I went in to ask the patient if they wanted the night meds. When the provider was talking to them, and they said yes. And turns out when I came to give the patient their medication, they declined the medication. So at this point, I'm just trying to make them comfortable, try to make them spend the night, and day shift is going to have to handle paperwork for the patient leaving against medical advice. And that was that for my patient. And then the other patient was on, or is on, continuous BiPAP, not necessarily because of hypercapnia or increased CO2. They just wanted the patient to more so for breathing, because they were becoming apneic at some point, or stopping to breathe. So they just wanted the BiPAP to keep the airways open. And so due to the pressure that the BiPAP machine has, the patient is to stay kind of strict NPO because of risk for aspiration. So this patient was getting very agitated that they wanted water, because BiPAP has a tendency of drying the airways and the mouth. So once in a while we'll take off the BiPAP and give them an oral swab just to moisten the mouth. But they were becoming very frustrated that it wasn't necessarily keeping them or helping with their test. So I had to call respiratory to come and switch the patient from BiPAP and see if they might tolerate the high flow. Fortunately, they are tolerating it now, for which previously they weren't. So once I switched them to the high flow, I had to reach out to the provider, because at this point they were screaming that they wanted to eat something. They're not eating their dinner and they were hungry. Reached out to the provider, and the provider now gave them a diet, of a regular diet, but turns out the patient has passed out. Anyways, in the sense of the patient is sleeping. And then I got a report for one of my patients who is coming from the ED, and I got reports for one of my patients who is coming from another facility or another hospital. So whilst I was waiting to come update you guys, my patient from the ED arrived on the floor. Turns out this patient is kind of stroke-like, has stroke-like symptoms, and they are currently having continuous migraine. I have to give them their fuel reset, for which the patient says it's not helping, but that they will gladly just take anything just to help out. And I did all the admission documentation, and the patient is well tucked in bed now, and sleeping. And I am still waiting. I have gotten a report for the patient who is coming from out of the hospital. At this point, all my patients are settled. I'm now in the break room. As you can hear the microwave, I'm here to take my break. And I'm still waiting for the patient from the other hospital to get here. In the meantime, I need to get settled, take my lunch break, and kind of await the patient from the other hospital. So I'll quickly take my break and I'll see you guys out there. In the meantime, let me show you guys what I got for my lunch break. I have this drink. It's kind of like a malt drink. I love this drink so much. It's very filling. And I brought pizza today. And I have an orange and an apple. So we'll see. I'm about to get my pizza from the microwave, and once I'm done, I'll see you guys out there with my chatting and all of that. So at this point, I'm already done with my shift assessment chatting, and when I leave from here, I'll go now and do my midnight chatting assessment. Guys, let me quickly take my break and I'll see you guys outside. See you on the other side. Look, I'm one of those nurses who is very obsessed on checking on her patients. Whenever I step out of the nursing station to come to the restroom or to the break room, I always check on my patients and make sure that I tell another nurse that, hey, if anything should happen, I'm in the break room and this is what is going on with this patient. So I always check up on my patient. And when I came back from updating you guys, I realized that my patient who came from the ED needed oxygen, and I had to pick up the nasal cannula to put them on at least 2 liters of oxygen. Now, I always love to check the rooms in which my new patients will be coming into, because sometimes the tech might forget to put what you are going to need, especially the very first vital signs that you need for your patient. So I love to make sure everything is in the room. So here I have the bed pad, I have my cleaning wipes, I have my the cord to the lead that monitors the heart, and here is the monitor for oxygen, the oxygen sensor, and here are the stickies for the electrode, or more so the things that monitor the heart, and there I have my blood pressure cuff. These are the basic things that I need. I very much will not even pay attention to if the cups, toothpaste, toothbrush and all those personal hygiene things are there, but with the vital signs thing, I always make sure that I have those in the room ready to go. And suctioning too is also one of the big things that you always have to make sure it's in the room, especially based on what the diagnosis of the patient is. Now, once I was done checking up on my room and I was sure that everything was in the room, it was now time for me to go do my midnight documentation. At this point, it was time for me to check if it was time for me to take down one of my patients for a CT scan, because one of them was having an abdominal pain and they needed to look at what was happening in the belly to see if they had a perforation or if they had an obstruction, just so that they can know how to better care for the patient. So here's the patient being swung onto the CT scan. Now, when I came back, it was obviously time for me to start finishing up on any documentation, and at the same time it coincided that my new patient arrived. I did all my assessments and took my basic vital signs, or my first vital signs for the patient, and it was now time for me to do documentations and to read everything about this patient. Now, most of the times when a patient is coming from another facility, especially if the patient is not from a facility that is a sister to the current facility, it's hard for you to look up information. So when the patient gets to the hospital, they have to transfer the patient's information from previous facility, and then I can look up the patient's information. Now, my patient from the ED had an allergic reaction and they came in with some migraine that nothing was helping them. So basically we were kind of giving them steroids and Benadryl just to help with the allergic reaction for the patient. So here I was pulling out the medication for the patient. Now it was time for me to go and administer this medication to the patient, and here I am gathering all my supplies and everything I'm going to need to administer this medication for the patient so they can feel better. You know how uncomfortable it is when you have an allergic reaction, or you have to be itching your body, or whatever reaction that comes with however your own allergy reacts to whatever it is. that is foreign to your system. If you're new to my channel, please do not forget to like, share and subscribe. I had everything ready to go for my patient. I always love to cluster my care. Get everything, get in the room, administer it, walk out, and you're done with that patient. Now I had to come back and start doing my 4 o'clock documentation. In between this time, guys, know that I've already taken my break. Sometimes I just forget to, record me taking my break, but just know that as the time goes by, I always take my break in between. And I love taking my 30 minutes break. As I told you guys in the break room, I don't like taking my break in the nursing station because I'm going to feel too distracted by talking with my fellow co-workers or keep checking on my patients. So it's going to interrupt my eating flow, and so I love taking my break in the break room. Now I had to check up if there was any other medications I needed to give to my patient, what labs I had to collect if there were any, and checking vital signs to make sure that all my patients are stable, but more so documenting my reassessment for my patient. Most of the times when it comes to reassessment, the patients are more so stable. There is minor changes from the assessment you had at the beginning of the shift, so it's pretty much just the same thing that you're documenting, if truth be told. Hi, we are actually growing and we are having new besties. I would love to know where you're watching me from. Is there any pertinent questions you have? I've had people ask me or comparing nursing in the US as opposed to their own countries. I love what I'm learning. I love what I'm hearing. Please keep dropping your comments and I respond to every comment. Now it was time for me to go pull another medication for one of my patients. How time flies. So at this point, one of my patients had a temperature, and usually when the techs tell you what the patient's temperature is, most of the times all patients on the floor or in the hospital are always going to be prescribed Tylenol, either a suppository or the tablet form. And so when the CNAs tell you that they have a temperature, you just have to go pull out Tylenol and give to the patient. Now this is me checking on my labs and rounding up with my documentation, especially my I's and O's, and validating vital signs, inputting the oxygens of my patient and any minor changes that might have occurred, updating the shift report or the shift summary in the system, updating my shift report which I'll be giving to the other nurse who is coming in the morning, as well as also updating the charge nurses report sheets which they use to give report between themselves, and pretty much just making sure that everything is up to date. For example, a patient started at the beginning of the shift with like 8 liters, and most of the times the goal is always to win your patient's oxygen down. And if at some point you win them down, you always have to document patient at 8 o'clock 8 liters of oxygen on oxymask. At 2 o'clock you document 6 liters. At 4 o'clock they came down to 3 liters. At maybe 5 o'clock the 3 liter oxygen wasn't okay, you had to bump it up back to 4. So you always have to keep up with your oxygen demands for your patients. Now drinking water is always a challenge, or it's always a very tedious thing for me, and so the one thing I found to make me drink water is to put lemon juice in my water. So in the pink water bottle that I have, I always put half a lemon, and I found that trick has worked like magic. I always end up finishing that bottle of water, and sometimes I always go for a second one. Look, I'm one of those nurses who is very obsessed with using the hand sanitizer, and so because I sanitize my hand a lot, my hands are always very dry, and so I love having my hand cream just to moisturize my hands, as well as my lip balm just to moisturize my lips. Sometimes I take my time to update my report sheet, especially that which I'll be giving to the oncoming nurse, but on days when it is very busy, there is nothing I can do about it, and so I just try to remember, especially my labs, to pass it on to the day shift nurse, maybe vital signs or anything that happened during my shift to let the oncoming nurse know. So updating your shift is going to be something very professional on your part as a nurse, so that the nurse who is coming on, especially day shift, would have a heads up or a beautiful start to her shift and not running around looking for information or digging up information regarding to the patient. Now, my new patient who came from another facility, the daughter was actually calling at this point. It was very early in the morning, but she was very worried as to how the dad was faring, because when they were getting ready to fly the patient out of the previous facility to this hospital, the patient was absolutely in hypotensive crisis, and so it was an emergency in that case. Okay guys, it's 5:55, time for 6 o'clock medications. Again, you know I'm always very excited when it is time for last set of medications. So I want to pull heparin. Just one patient has medication this morning, so I'll be pulling the heparin. I'll be going out there to document my eye samples, basically cutting my teeth and dotting my eyes, and just pull the only medication. I really want to take this time again to welcome all my new besties, all the new nurses, nursing students, aspiring nurses, those who look up to my videos that inspire them. I know many people have reached out to say that my videos are inspiring, my videos are encouraging, and so I love to do what I do. And let me know if there's any other thing you guys want to see, especially about the step down unit, or if there's anything generalized about nursing or maybe healthcare in the US. I can always create those videos. And so I love reading your comments. Guys, hit me up, let's hook up. And I love seeing all your thoughts and expressing yourself as to what you think about how I practice my own nursing. I am always very excited when it is time to go home, getting into the elevator, hitting the first floor, and just walking out of this hospital is always a therapeutic, beautiful feeling, especially when the fresh air hits your face and you know that you're this close to going home. Thank you all for staying right up to the end of this video. It means the world to me that you guys love my videos and choose to stay right up to the end of these videos. Please do not forget to like, share, and subscribe to my channel where I talk a lot about nursing and other things. I love you guys. Mwah.